go. Why, happy Wednesday. This is a Wisdom Wednesday podcast with Dr. Mary Seegers, and I am so honored to have a very special guest today. But before I introduce her, you know the drill. Grab your coffee cup, your orange juice, or your water, and join in on the conversation. Today, as you know, we've been for the whole month of September, we've been allowing some experts to come on to share about this very important issue, which is the mental health awareness. And yesterday, I believe, was the Mental Health Awareness Day. So we want to keep that fresh in our mind. We need to talk about it so we can remove the stigma that's been associated with this. Just like diabetes, this is another disease that capable of being cured and preventive, and learning how, not so much preventive, but how to manage it and handle it. So my guest today, I'm so honored to have her, is Dr. Lisa Fuller. How are you, my sister?
I'm fine. And how are you?
I'm great. I'm so glad you're here to share with us today. Let me share with the audience a little bit more about this phenomenal woman. Dr. Lisa Fuller is a psychiatrist and mental health consultant. For more, excuse me, for more than 30 years, Dr. Lisa H. Fuller has practiced psychiatry in Michigan, Ohio, Indiana, and West Virginia. Presently, Dr. Fuller is the CEO and medical director for Discern Life Consulting Health. Dr. Lisa H. Fuller provides mental health awareness and training for organizations, chaplain corps, and churches. Dr. Fuller has service and led mission teams on the continents of Africa, Asia, Europe, and North America, with focus on medical care, mental health, crisis trauma, leadership development, and spirituality. And Dr. Lisa H. Fuller is available for speaking engagement as well as staff and corporate mental health training. Wow, I just honor you for what you do, and you do it with such a great passion. Do you want to tell us a little bit more? How did you even get into this line of business?
you know, I just laugh because it's twofold.
Mhm.
The goal, the drill that they were training me, molding me for was surgery.
Oh,
And I had young children as I was going through,
yeah.
internship, residency, and you have this epiphany.
Mhm.
It's a tragic story, but it has a good ending. So what happens is that the resident that I was on the surgery rotation with, she was pregnant with twins,
Mhm.
miscarried, and
Right.
she was at the hospital all day and all night. And
Gee.
I want to spend time with my children. I want to see them and watch them grow up. And
Yeah.
so that's how, psychiatry, that, it's a fit. I look now and say, it's a perfect fit. It's God's plan for me. It's a fit.
Mhm.
Mhm.
Yes.
Mhm.
And it's so needed too. It's a real needed field because, like you said, people go to surgeons and the other things, all because of what they want to do. But if God's using you to help people, that is so, so important. As I mentioned earlier, we're celebrating or acknowledging or recognizing that October is also the month for mental health awareness. And I mean, for so long, there was a stigma and people didn't want to talk about it. How can we get out of that old thinking and, be open to talking about it, showing how we can help and be aware that people may be having mental, you know, um, illness or whatever.
I'm glad you said that because programs like this podcast, community awareness, events, going into the barbershops, going into the nail salons, and just talking about it, going into the schools,
Yeah.
starting conversation, grassroots organization, because the more we talk about it, the less the stigmas, are there, they go away.
Yes. Yeah. Mentioning that, you just had a workshop this past weekend. Do you mind sharing with the audience some of the details about that and any upcoming event that you might be having?
Yeah, it was it was Tri-County Mental Health Fair. And
Mm.
so it incorporated Oakland County and Macomb County and Wayne County and even Washtenaw County. And
Oh,
the participants were there, the panelists. We started with the panel discussion.
mhm.
So Senator McDonald was there, Father Kerr was there, Courtney Cabell, who's a graduate student, a doctoral graduate student in counseling. She was there on the panel, and a pre-med student who wanted and he's aspiring to be a psychiatrist based on he said, his experience in the mental health system. So that was phenomenal. And then afterwards, Dr. Show she talked about pastoral care and when to refer to a professional mental health expert. And then we had breakout sessions, a discussion about autism, the struggles of depression, surviving trauma. It was just amazing.
Yes.
Um, it like I said, I could go on and on. There was such a demand
Mhm.
that and such a need for that. The people asked for more. So
Wow.
yes, yes. And October the 22nd, we're going to have a virtual recap follow-up of
Mhm.
discussion about autism, the struggles of depression, and also surviving trauma, which is very needed in this time. Mhm.
Absolutely. Mentioning that, we're still in it, but for the last 2.5 years, people felt isolated. Depression was very heavy. And I also read in an account that had went up during the whole pandemic time. So it's real. People feel depressed, and people who think, we think they have everything, like that model or whatever. Remember, she just jumped off, or allegedly jumped off the balcony. I mean, you never know what people are going through, you never know. So if we see something like that in our families or our loved ones, what would you, as a psychiatrist, suggest that a loved one, can help that person, and their loved one?
It's really important not to criticize and not to belittle. There's myths and there's facts,
Mhm.
everything. And so, it's like, oh, yeah, you need to man up or you need to woman up and be strong. You need to be better than that. And that is such a myth. You know, helping someone is identifying and being empathetic. Like, I can get you some help. We can go together. I can go to the appointment with you, or you can go in by yourself. But you need a little bit more than what you can get here.
Mhm.
Identifying and helping the family unit
Yes.
to, identify with the person, let them know one, they're supported, they're
Mm.
not little, they're not, shameful or experiencing it. It's like, we're with you.
Mhm.
Tell you something. I want to share something with you. Do you know that, and this is amazing,
Mhm.
according to CDC, over 50% of Americans
Mhm.
experience at one point in their life
Mhm.
may experience a mental illness. Isn't that amazing? And then
Wow.
within the year. Isn't
Mhm.
that amazing? We're talking about people in the United States. We haven't even began to talk about people in other, the globe.
Right.
So it's real. And so family members, acknowledging this is real. It
Mm.
doesn't mean they're violent, doesn't mean they have a character flaw, it doesn't mean they have a weakness. What
Mm.
it means, it's an illness and we're in it together. Mhm.
Yes, wow. Those statistics are very alarming, but it doesn't surprise me, because we can relate to people we know, family members. And just a recent incident here in our state, you might have recall hearing it on the news as well, Dr. Lisa, when the family member called 911 because of their loved one was mentally disturbed. And when the cops came, I don't know if they're not trained how to handle someone that's in a mental state like that. But of course, we heard all of the news, he was shot, what was it, 38 times or whatever. Another life loss, you know what I'm saying? Because we didn't know how can the society or the police officer, work with the community to help people that are in those conditions. Do
You
you?
know, that's interesting. My son is in law enforcement.
Okay.
It's a very, very stressful job.
It is. Yes.
It's not, and I mean, he literally is cut for it. He's designed for it. He's
Hmm.
EPD, but he's another part of law enforcement. And so
Hmm.
what happens is it's not a matter of, oh, do you want to work a double? It's, well, we're sure you need to work a double, you know. So being committed, and and there's twofold. So if you can allow me to, and then the other thing is that we don't know what stressors, what predispositions, what prejudice, and when I say prejudice, I mean preconceived or pre-already obtained ideas or thoughts of beliefs about something or someone exist.
Hmm.
So as a result, you know, the person who is a law enforcement officer, that needs to be looked at. You know, again, the suicide rate in law enforcement and substance use disorder, you know, is substantial because the job is stressful.
Amen. Yes.
Going to the other side, the flip side is that it's very, very, very unfortunate because we are seeing an alarming number of people of certain ethnicities uh, this occur.
Mm-hmm.
The problem is that we have to again be educated, and I just want to throw something at you that someone said to me, and it's really interesting.
Hmm.
Being educated, sitting in a classroom,
Right.
part of someone's job may say, oh, I have to get this, I just got to get through this,
Hmm.
versus actually working through and being empathetic and knowing or understanding what someone, just because they may be green, brown, purple, pink, gray, or whatever, may be going through in their lifetime.
Hmm.
It has to be an engagement. It's not just you're sitting here because you have to sit here. You know what I mean?
Yes. Yes. Wow. Yeah, I think we have a serious problem in our community, but it has to have an understanding, that communication with the law enforcers, and with the medical arena, because there are more people feeling, depressed, and so it's just, especially after we're just coming out of this pandemic, right?
Mhm, mhm,
And so we just have to recognize that people are in a different states sometimes.
mhm.
Let me ask you this too, Dr. Lisa, if you don't mind. In your practice, have you seen more of an increase with children being more diagnosed in that, like autistic? You had mentioned autistic as well as the mental illness. Have you noticed that uptick in that, or?
As our society, you know, I've worked with one of the organizations in the city of Detroit on
Mhm,
20 years with respect to
mhm,
children, and I'm the medical director. And what happens is
mhm,
that as our society, uh,
mhm,
as we see more incidents, more trauma, more events in
mhm.
our society, yes, we see it in the children because they are in the family units. They
That's
are, you know, the either victims or the result of or experiencing the
right.
abuse, the neglect, the trauma, or witnessing it, or even
Mhm,
going without, meaning, you know, a lot of people don't have jobs, just
mhm,
so it may be someone who's really trying and loves their children, but they don't have resources, but they
mhm.
don't have their lights on. And
Right.
so that means maybe Child Protective Services is coming in and takes their children. Well, it creates a whole different set of abandonment and anger and distrust. So there's so many different dynamics that we're dealing with. And
Mhm,
of course, the grief
mhm.
and loss, you know, as a result of the pandemic that several of us experience. Mhm.
Yes, yeah, that is just like a double, more of that.
Mhm.
Yes, I know the more we talk about it, I think, I'm thinking back in my own family how it was a hush hush thing. We don't talk about it. The uncle that's always stayed in his room and just leave Uncle Willie alone or leave,
Mhm.
because we were either ashamed or had that stigma attached to it. And so had we got help for Uncle Willie, he might have been able to function in,
Yeah.
in society. But sometimes we shame and us shame will cause family members to say, let's not talk about it, put it under the rug and it'll go away.
Mhm.
It won't go away, right?
Mm-mm. Mm-mm.
I've heard a minister, a pastor really say this. He said he needs Jesus and he needs a therapist, So, 'cause sometimes you just really need to get that help that's been trained. There was a Christian therapist, was able to help them go through some things that trauma, grief, death. Sometimes we just need to be able to extend that uh how we feel and won't be, accused of being weak or being, not strong enough to handle things. You think we're seeing more and more of that, the people acknowledging they may need, the Lord as well as a therapist or a psychiatrist. You know what I'm saying?
Well, one of the myths is that, I should say, one of the myths is
Mhm,
your faith isn't strong enough. You don't have enough faith. All
mhm,
you need to
mhm.
do is pray through it. And
Yeah.
reality is, first off, God,
Mhm,
He heals by signs, wonders, and miracles. He heals
mhm.
over time, and
Yeah.
He heals by the use of clinicians, providers, doctors. That's
Yeah.
important. And the other thing I want to say, three things, is that the second thing is that in a Christian counseling that you had mentioned a second ago, there is the patient, the therapist, and Holy Spirit.
Yes. Yes.
And the third thing is that when people are experiencing a mental illness and are just really, really down, or really, really depressed,
Mhm,
what happens is they don't think straight. I mean, I can get, and I don't want to, because of time, go into like, neurochemicals and the way we transmit. But what I just want to say is it's a
mhm,
cognitive misinterpretation, or they just don't think straight. So it may require medication, or
mhm,
it may only require someone talking to them and supporting them in their environment. They may have an environment that's very stressful,
mhm,
helping them to navigate through the system so they can have resources, so they can have food, so they can have clothes, so they can have a home.
mhm,
So those things to say, as all of that
mhm,
improves, then, and with the therapist, their thinking may
mhm,
begin to improve, or usually does, as
mhm.
well as, again, I'm talking Christian counseling. What
Yeah.
is their faith? We're taking them through a journey so their faith will improve, or be stronger, be strengthened, so
Yeah.
it can begin to function.
Mm.
Sometimes when you're stressed, you can't even pray.
That's true. That is
Mhm.
so true. Yes, yes. And so we need to, that's why I think the churches now are more open to actually understanding, that side of a human being,
Mhm.
and it's not lack of faith. Sometimes, like you said, you just need that support and the medical part of it, because we are
Mhm.
we're human as well as the spiritual and the soulish realm. So yeah,
Yeah.
so the totality of that person, you're looking at that. Have you found also too, if you don't mind me asking, is a lot of the mental health, is that hereditary or is that another myth? Or my father had it. People say there's, is that possible that mental illness could be hereditary?
That can be a predisposition
Okay.
position to that. And the reason I say that, and it's really interesting on
Mm,
different levels,
okay.
but I say all that to say, on one level, yes, there is, can be, the
Mhm,
for a predisposition, because
mm,
that's one of the things we asked in our history,
mm.
in your family with depression, bipolar disorder, etc.
Right.
On a spiritual aspect,
Okay.
we're talking about generational curses.
Okay. Yes. Mhm,
So different levels, different, like I said, different
mhm.
levels. And
Yeah.
I want to go one step further. So when someone goes to the primary care doc,
Mm,
because I was trained in medicine, what happens is, do you have high blood pressure? Do you have diabetes, et cetera, et cetera?
mhm.
Problems. And again, you ask this history. What did your family have? Because it's all in the genre of, this is an illness.
Mhm. And
Mhm.
we recognize it like that and not put it, as something taboo, we'll be able to talk about it and trying to find solutions and resolutions for family members and loved ones that are going through it. Just like you said,
Mhm.
diabetes or heart, or cancer,
Yeah.
Yeah. Yeah, that's so important. Oh, wow. I mean, I'm just, how can people reach out to you as regarding this upcoming, you said October 22nd, I believe.
Mhm.
That's a Saturday or is that
Saturday.
okay?
Mhm.
Is
Mhm.
that, will you have something on your social media? Help them if someone wants to join in. You said it was a virtual, right?
Mhm. Absolutely. It's discernlifeconsultant.com
Hmm.
slash Tri-County Mental Health, or just discernlifeconsultants.com. And then my social media. But if you can't remember those, you can go to lisahfuller.com. Real simple, lisahfuller.com, because there are links that we have partnerships and there are links to the different websites.
Okay.
As I said, it's virtual, it's
Yeah.
free, and we welcome everyone.
Awesome. And I think the more people talk about it, hear about it, and understand it, there's a better understanding about that as well, you know?
Yeah,
So
yeah.
I just appreciate you coming in with your expertise. I honor you for that. And, I've been missing you. So it's good we had a chance to talk about this very serious subject because I always say the wisdom nuggets will help a person in their life, in their everyday life. And you've done that today, Dr. Lisa. So you have any last encouraging words for our audience before we depart? I could talk all day with you.
Well, first and foremost, I just want to thank you because this is absolutely, your podcast is amazing.
Thank you.
Thank you so much for allowing me the opportunity. And for those who are listening, I just want to say, don't be ashamed. Don't feel guilty. Don't feel that you're weak. It's important that same way you go to the dentist, same way you go to the emergency department, if you have, like a seizure or whatever, it's okay.
Mhm,
Okay, it doesn't mean a character flaw, doesn't mean you don't have enough faith. And
mhm.
um, it means just seeking help.
Yeah,
People have the um, let me just say this, everyone has the
yes,
right to health care. And
mhm,
that's health care.
yes.
Mhm.
I agree. I agree. Thank you so much for those encouraging words. And until next time, I do want to mention to the audience next week, October the 19th, I'll be traveling with my husband, so we won't have a podcast, but we'll be back on the 26th, I believe it is, with some more information about the mental health awareness and getting ready for the, shutting down this year. This year been 2022 has been epic. I've been calling it epic since the beginning of the year. And we're going to close out with the epic year, knowing that we can do all things through Christ who's going to strengthen us. So until next time, I'll see you. Thank you again. Bye for now.